Welcome, welcome, welcome to G's One of One Sunday Night Live. Sunday Night Live. What up, what up, what up? Glad y'all could join me. So we're going to get started in about 5 minutes. I like to allow people to get notifications that we live so they can chime in. I feel like Sunday nights is a safe time where the airways are clear, So if you decide to actually come hang with G's One of One, you can do so without interrupting any other channels or anybody else that you normally listen to. Especially this time, I'm a little tardy because I like to start 8:39, but it's 9:30 now, so it is what it is. We won't keep you too long, but we're going to get right into it since it's Sunday night. We'll talk a little bit about the Retta because I did go over the actual. I did do a video on the details, but we'll talk a little bit about the. We'll just do a quick overview, and then we'll get into a few other topics that I would like to talk about tonight. So let's just hang out for a little bit and allow others to get the notifications that we're live. All right. Again, like I said, appreciate y'all for joining G's One of One tonight since it's Sunday night and everybody is like we're probably chilling right now on the east because it's 9:30, but on the west it's 6:30. So you guys could still be out and about. But hopefully it's a good time for everybody to jump in and hang with us for a little bit so we can go over some of this GLP-1 news. So we're gonna get started in about another 2 minutes. I just wanted to, like I said, give people a little bit of time to get the notifications that we're live. I didn't set the schedule. I probably should have, but I didn't. But next time I'll make sure that I actually schedule it next week because I didn't schedule it this week. So we will schedule it for next week. So we're gonna get started in about 2 minutes. In about 2 minutes. We're just allowing others to get the notifications that we're live. So that's what our pause is. We're gonna, I did do a short and a video. So if you haven't seen those, feel free to go and check them out. We did a short on, I believe, Thursday, and we did a video same day, but later that night, surrounding Retta. So. And obviously, there's a multitude of different things out there that could be used, but this is a big one. This is the one that everybody's been waiting for, so it should be interesting. Shout out to Twan and everybody that was at the obesity conference down there in Orlando. I got to watch her live, and I saw for a quick minute. So I actually saw some of the people. I was curious to know who they were based on their channel. I saw Traveling T, which I didn't know who it was because her profile was just like a dog with like I think a dog in like a blanket. so seeing her, and then I think I seen Z. I saw who else? Some I've already seen, been on panels with, but just some of the other people that I don't know. It was cool actually that Twine went live and we could actually see them. So I think that was cool. The people that we don't get an opportunity to see, that don't really make content but have channels. So that was cool. So we're gonna get started in about 15 seconds here. Like I said, just wanted to go to the 5 minute mark like I generally do, just to allow people to actually get that notification, because usually I've seen that that's where it kind of happens, where other people get the notifications. So when you do come in, please like and subscribe. If this is what it is that you would like the algorithm to suggest to you when you're actually surfing. So let's get right into it. So, Eli Lilly says it was filed for approval of the next generation obesity drug in 2027 as it clears 2 more trials. This was Thursday that they actually reported that. So on Thursday, it was filed for approval of the next generation obesity drug in the first quarter. Eli Lilly said it will file for approval of its next generation obesity drug in the first quarter of 2027 as the treatment succeeds in 2 more late stage trials. The pharmaceutical giant previously said it would submit an application as early as this year for the weekly injection retatrutide, which works differently and appears to be more effective than existing shots and pills. In a statement to CNBC, Lilly said it needs more time to gather and verify the manufacturer and quality control data required by regulators before it can seek approval. In 2 separate phase 3 trials, retatrutide delivered I'm about to say retatrutide because that's the other thing that people often say, but retatrutide is the way that I believe they said the proper pronunciation is. Excuse me. So, retatrutide delivered significant weight loss and improvements in a key measure of blood sugar levels in adults with obesity and 2 major complications: type 2 diabetes and established cardiovascular disease. So if you go back to my Thursday video, you can actually see where I actually break that down. So we'll go a little bit farther. Based on data, the company believes it has the information necessary to file for approval globally for retatrutide as a potential treatment for obesity, knee arthritis pain, and obstructive sleep apnea. So obviously the key there you see is the knee arthritis pain and sleep apnea as something other than obesity. I feel like they're doing to help in getting this approved by possible PBMs. In 1 trial, adults with obesity and diabetes taking the drug lost up to an average of 21% of their body weight, or nearly 50 pounds, at 80 weeks. The population typically struggles to lose weight. So that is a thing, right? That was why I pretty much did the breaking news and everything like that, because a lot of us know that those that have suffer with diabetes oftentimes have issue with losing weight the same way others do. So to actually see them get 21%, like people that are non-diabetics that take Zepbound, is amazing. So that means that those individuals could see a lot of their other biomarkers improve too with that kind of weight loss. In another trial, adults with severe obesity and established cardiovascular disease with or without diabetes on the treatment lost up to an average of 22% or almost 23% of their weight, or 55, nearly 56 pounds, at 80 weeks. Retatrutide meaningfully reduced certain cardiovascular risk in patients. So I also went over that because that's another one where I feel like they have a targeted audience, I believe, at what they're going to try to aim this at. Because with them actually coming out, and the reason why this is going to take a little bit longer than you might not see it out in literally in the pharmacy and available to pick up in early 2027, because they're actually going to probably push for biologic status, right? So if they push for a biological status, what it does is it gives them a longer patent, and it doesn't allow compounders to compound, right? So they pretty much want to eradicate that. They're not going to deal with that this time around. So there's a possibility you probably won't really see it until next year this time, on the shelves or in the pharmacy, or maybe even early 2028. But I think with the way they're fast tracking, they're not going to wait a year and a half, because they know people have been already, using it on the gray market and everything like that. And I think they're just, crossing their T's and dotting their I's, and they're going to actually push this thing out as fast as they can, but in the right way. The side effects associated with the drug were consistent across the 2 trials, as well as previous studies on the treatment. The most common included diarrhea, nausea, constipation, which are also seen across the broader GLP-1 class. So this is very normal. It's highly normal, and that's pretty much what you generally see. Because for those that might know, it's a triple agonist. It's GLP, GIP, and glucagon. So the primary difference is the glucagon factor. And it's being said that a lot of times you have to get to the higher doses and actually for the glucagon to actually kick in. Is that 100% accurate? I don't know. Nobody really. I don't know if anybody really knows. I think that that's just what's being said at the moment. And well, not that's what's being said, but that's something that people think based on what they saw, in the actual, gray market and compounders out there. So, but I can believe it, because glucagon is a completely different factor than the GLP-1 and GLP and GIP. So they're saying that usually it activates at the 4 milligram. So they're trying to. Well, some people, some physicians or YouTube physicians are saying that people that actually get on it probably should not need to titrate so far up as they did with like the earlier medications. They should get decent efficacy at lower doses. Now, me in my own head, I think that you probably don't need a 12 milligram because it's a triple agonist, but you probably will end up on a 9, for like maintenance or to get the the best result, because the 9. Hey, how you doing, Z? It was cool seeing Twan's video because I'm pretty sure like I think that was you down there at the conference, so it was good to see you. So yeah, I think that what's going to happen is um, people that actually take that, take retatrutide are probably going to end up on the 9 to see like the most weight loss. But I don't think they probably don't have to go to a 12 milligram. It's available there, but I don't know if they'll need to push there because with it being a triple agonist, you'll probably be able to lose all that you need to lose utilizing it that way. So there are now positive results for 5 late-stage trials on retatrutide, which Lilly is positioning as the next pillar of its obesity portfolio. After its injection Zepbound and newly launched pill Foundayo. In January, TD Cowell analysis estimated that retatrutide could rake in sales of nearly $4 billion in 2030. That's a lot of money. That's a lot of money. $4 billion, it's amazing. Retatrutide is also critical. Retatrutide is also critical to the drug maker's plan to maintain its market share majority over Novo's Nordisk in the booming market for weight loss and diabetes drugs. Some analysts estimate the segment could be worth about $100 billion by the 2030s. Dubbed the Triple G, retatrutide targets GLP-1, GIP, and glucagon rather than just one or two of those hormones like existing treatments. That appears to have more potent effects on a person's appetite and satisfaction with food than other treatments. Tirzepatide mimics GLP-1 and GIP. Novo Nordisk semaglutide, with the active ingredient in Wegovy, mimics only GLP-1. So, very interesting. Like I said, I want to start that. That's what I actually went over in the earlier video that I did on Thursday. And that's what the breaking news, that I wanted to bring because those that have diabetes or diabetics have been, unable to actually lose a significant amount of weight. And now with this, that's definitely a possibility, Now, obviously, cost, and availability is going to be a thing, especially if they're trying to, make it classified as a biologic. And what good is a drug that nobody can take, right? It doesn't really. All right, I'm back. Yeah, my Wi-Fi was acting up for a second, but it was crazy. I have a router upstairs, router downstairs. But we back. So yeah. So I think that those that haven't been able to see weight loss will now be able to see it. They'll now be able to see it, like everybody else. And just to go into it just a little bit more, so the highest dose. So the highest dose help patients with obesity and a type of knee arthritis lose an average of 24% of their body weight at 68 weeks, right? So when analyzing all participants, including those who discontinued treatment, I think am I muted? I'm muted? Let me fix that. That's not good. That's not good. How about now, Darren? Can you hear me now? Is it is it still muted? If y'all can hear me, just put up a little microphone in the chat. If y'all can't hear me, let me know, because I don't want to. Hey, Shawnee. All right, good. Glad y'all can hear me, because Darren said I was muted. So hopefully I wasn't muted for the last 16 minutes. Because if I was muted for the last 16 minutes, that's kind of crazy. So I'm hoping that on the playback, I'll be able to. Hold on, give me 1 second. 1 second. Because that probably was inadvertent, because when something happened with the Wi-Fi, and then it kind of dropped me and brought me back. So let me see. Okay, no. So it's good, because I have it on playback too on my big screen, so I'm able to see over and hear over there. So I actually can play back for myself over there. So I know I'm not about to say, I know I ain't just do all that and nobody can hear it. That'd be crazy. But I've seen crazier things happen, I'll tell you that much. So all good. But yes, so we were, and hello to everybody tonight. Shani, Darium, Z, everybody that actually stopped in to holler at me. Appreciate y'all. But we talking about retatrutide because I wanted to open with that, because I know several people saw my short and my video earlier saying that we would dive a little bit deeper on Sunday because I would have more time. So this is that time. Since I got more time, I wanted to make sure that I came back and actually, delivered what I was talking about. So that's all. All right. So where were we? So basically, I was saying that the highest dose of the drug helped patients with obesity and a type of knee arthritis lose an average of 24% of their body weight at 68 weeks. When analyzing all patients, including those who discontinued treatment, when evaluating only patients who stayed on the drug, the highest dose delivered 29% on average. So a lot of us do know that. Eli Lilly appears to be positioning the drug strategically for people with severe obesity or a body mass index above 35 or 40. She noted that the company said 84% of patients in the trial had a BMI above that number in the trial. So I don't know which one they're going to settle on, 35 or 40, because there is a difference between 35 and 40. You know what I mean? Like I like to tell people, when I first started, I was nearly 43%. My BMI was nearly a 43. Today I'm a 29. You know what I mean? So I'm able to come out of obesity, but it took me 100 pounds to do it. You know what I mean? But hey, any day with Christopher with the down, any day you wake up 100 pounds lighter is a good day. You know what I mean? So it's a double whammy, because not only did that 100 pounds, make me feel better, I also climbed out of obesity, with that. Now I am trying to get a little bit farther away from obesity, so that way when I gain, 10 or 15 pounds, I'm not right back, So that's where we are right now. My actual bottom is probably like 20 pounds. That's the most I would be willing to, or I even care to lose, maybe another 20 pounds, but maybe not even so much, because when I've had a consultation with a surgeon, and that surgeon, it was for lipo, which is 360 lipo, which is really like encompassing my abdomen and flank area, because regardless of the recomping that I do, I still think I'm gonna have a little bit of fat stored in that area that's gonna be stubborn. So the way I look at that is self-care, So I want everybody on here that actually has been obese that actually get out of obesity and lose a substantial amount of weight, meaning like in the triple digits, like I did, 100 pounds. Or if you're like a smaller person that lose, 50, 60, 70 pounds, because my wife also had a consultation and she lost over 50 pounds. She is 145 pounds right now, 52 pounds down. So kudos to her. But even people that are let's say maybe lost 50, 60 pounds, but maybe of a smaller stature, same thing. But because I'm a 6 foot male that lost triple digits or 100 pounds, I think it's self-care to actually go and see about things like that and give yourself the option. Because I already know even if I lose another 20 pounds, I might more than likely still have to deal with that stubborn, fat there. So and my visceral fat, all my biomarkers are pretty much flawless. Everybody can go and see all the posts that I do. I do a lot of posting, so even when I'm not actually making as much videos as people throughout the week, I post a lot of things. So hopefully you guys got to go and see the post that I did about the weekly meals that I put up to lose weight, the weekly meals I put up to gain muscle, the charts that I put up for judging protein from different sources, fiber from different sources, carbs, all of that. I have very, very detailed information on my page in my post. If you care or if you need that help, is all there. I also usually I put my metrics in there. It's probably been about a month or so since I put metrics in there. But today I'm 219 pounds. I've gotten as low as 214 pounds. I came off of my shot for 14 days and I was on vacation and I actually picked up a little bit of pounds, but then I lost most of it back when I came back from traveling. And the reason why, if people missed that I was off my shot was because I actually was feeling extremely fatigued and I didn't feel well prior to leaving, for the trip. So I actually went and got checked out, got all of my blood work ran. They said I was good. And to not exacerbate that, I basically was off the shot for 14 days. Technically, I missed one pen, but it's just the way that I took it. I was due for the shot and didn't take it. And then I took it like the following Friday. So I wasn't off of it for 14 days, but it had been 14 days since I took a shot. Let me say that because I don't want to. So technically, it was probably more like 7 days, right? Because I had took the shot, and then when it's time for me to take my shot, I didn't take the shot. So I just wanted to make that make sense. And then the following Friday, I took the shot, again. But those things have resolved. I actually followed up and got more blood work after that. My blood work looks flawless like usual. Everything is really good. My body fat is inching down. I have a goal of trying to get to about 15%. So we'll see what happens. All of my metrics look really, really, really good, like always. And even my kidney metric even is in a better position because I'm usually in the 70s, but my kidney metric is now showing 81. So that has even improved. So I've never had any issue with my kidney or anything like that, but I'm just saying like that's usually what my reading was, right? Because everybody that has a good reading don't mean it's optimal, right? So for the most part, most of, if not 99% of my readings are generally optimal, except for maybe one or two, and that was one of them that's usually in the good spot, but not optimal, because optimal would be 100%, right? You want your kidney functioning at 100%, but it's not realistic for middle-aged men with hypertension to have 100% kidney because you've been through hypertension, especially if you suffer with hypertension all your life like me. So or at least all my adulthood, I actually am usually in the 70s, and I'm talking about my EGFR rate, for people that are curious what I mean by that. But I'm in the 80s now. I was at 80, I believe it was like 81 or something like that last time I checked. So that's really good. But I had a little bit of that. But it was kind of ruled. What we figured out is that basically I've been in a caloric deficit for a long time, you know what I'm saying, a year and a half. So being in a caloric deficit like that all the time, and those that know I do intermittent fasting, it was just something that caught up, not something I was specifically doing wrong at the moment, but I did increase. So that's where the little bit of weight came from. I mean, I'm still 100 pounds down, still out of obesity. I'm at 219, but that's where the little increase came from. The lowest weight I've been is 214, but I think that I wasn't at that 214 the most healthy way. You know what I mean? I might have been under eating, that week that I held that. and 219 has felt better. You know what I mean? So I'm kind of here, and then I'm working down in a smarter way. You know, and what I mean by that is through just resistance training, but also keeping my calories high enough to where I can get through that resistance training, because the resistance training and lifting weights also increase appetite, right? So my appetite, I'm on 15 milligrams of Zepbound, and it does, it does the job, But also when you lift weights and work out like that, it can increase appetite a little bit. So you want to make sure you're eating smart and not just eating, whatever. You know what I'm saying? So that is a thing. So that's why I'm not really focused on total weight loss. I still continue to look at my body recomposition, with the muscle and water, and skeletal muscle, body fat, and things of that nature. Total body weight, you can't really like let that bog you down and worry. Even if you got like 20 pounds to go, like me, and a lot of other people, you can't let that bog you down. You know what I mean? Because that's not that's something that's gonna, has its, a lot of times it'll stall, but you got to pay attention to so many other things. You got to look at your clothing. You got to look at your waist circumference. How things are fitting you, how you look in the mirror. You know what I mean? And I really like how I look in the mirror. Like I like how my chests are formulating really well. My arms are getting bigger. You know what I'm saying? So I really like it because that's showing that like the weightlifting and all the stuff that I'm doing, is really working. You know what I mean? So you see in the fruits of your labor. So that's what I like. And I'm lifting heavier now. You know what I mean? I'm lifting, heavier weights. So and praise God for that, because most know I had issues with my neck, and I haven't been having that, and I've been able to get through lifting weights heavy, and it's doing really well. So I make sure that I get like 30 minutes weightlifting in at least 4 days a week now. So I'm doing that 4 days a week, 30 minutes, and then I'm still doing my walking 4 to 5 days a week. I'm still at a mile, but I'm going to increase that to 2 miles probably next week, just to see if I can see more of a uptick in the the fat coming down, and the muscle going up. So good things, all good things, you know what I mean? So I'm really excited about all of that, and I'm gonna keep on, chucking away. So, but in the community, so I've seen a lot of things, I always sit back and look, and then I can give my opinion once I actually get on here, but I've seen varying things from a varying degree of things from different people. So like I was saying, shout out to everybody that went down to that obesity conference. To my knowledge, to my understanding, it was about those that actually had different surgeries, and giving them, and then and giving support and talking about their experience. Not necessarily GLP-1s, I don't believe. So if I'm, correct me if I'm wrong, but I think that's kind of what it was based on what I saw. So shout out to y'all, because like I said, I got to see some of the people that are on here that we see that don't really, they don't really do content, and you don't get to see them in front of the camera. But you do see them in the comments all the time. So shout out to y'all, because I was able to see some of y'all. So, and it's crazy because like some of the names definitely, like are much different than what you think when you actually see the people. You know what I mean? Z, like when I was seeing ZHA, I didn't even know it was a lady. You know what I mean? So shout out to you. I was saying Traveling T. Her profile picture is like a dog with a blanket. So seeing these people is like really cool. You know what I'm saying? Hey, Traveling T, you in there? So it's really cool, like seeing, like being able to see, like Twan. Yeah, Zia, you probably are the shocker though, because I mean your name the ZHA. I'm like, who is this? And then now I think you got me on Instagram. So with us, with you following me on Instagram too. That's all cool. So, anybody that don't know, y'all can follow me on Instagram, G's33. So if y'all want to see more, because I post way more, I'm more active, you know what I mean, on there. This is like once a week because it's more structured, and it takes a lot more to do this. But Instagram, I post a lot of stuff, post my family, post my wife. So if y'all want to see pictures of us, y'all can go there anytime and check it out. So. Absolutely, Darian. Absolutely. So, yeah, I might. July is really tough because that's usually when we vacation with the kids. But I'm definitely gonna get to one of them so that way we can meet. I can meet some people in person too, for sure. I still got to get to Vegas to see the fellas, man. We got to make that happen, Darian. So that's a serious thing. Hey everyone, my ears must have been burning. Yes, my pick is a dog who passed away. Great seeing everyone. Okay, traveling T. Yeah, it's not even that. It's just that, like, seeing you, I'm like, I wouldn't think that's who you are because I don't see any pictures or there's no content on your page. So then when we get to see, like, it's like, oh, okay, that's traveling T. Vacant is July 22nd, 24th. Cool, cool. So everybody, Darren says that the next obesity conference is July 22nd to 24th, 2027. So I think that's gonna be, you know, a good time because it's New Orleans. It's New Orleans. But we definitely gotta get together before that. Us and all the rest of the fellas. You know what I mean? Yeah, well, that's what I was saying, traveling T. When everybody sees Z name, like they don't, you know, then you see her in person, it's like so it's a lady, like, you know, but you don't think that, you know, by seeing just the name. So yeah, so we were talking about the things that I saw in the community. I mean, I opened up with the Retta, you know, talked about that. Like I said, I don't think that they're going to be it's going to be a little bit longer for them to actually come out with it because they're trying to qualify it as a biologic. So they don't want any hurdles. So I think they're going to try to make sure that they actually land it appropriately to not have any hiccups. But just to finish what I was reading, where was I? It's a critical part of the drug maker's plan to maintain its market share over Novo Nordisk in the booming market for weight loss and diabetes drugs. Some analysts estimate the segment could be worth about $100 billion by the 2030s. Retatrutide also met the trial's other main goal of reducing pain from knee arthritis, a common condition that wears down the joint's cartilage and leads to pain and stiffness by up to 63% on average when analyzing all patients based on a widely used survey. More than 1 in 8 patients who took the drug were completely free from knee pain by the end of the trial. One concern with current weight loss drugs is that they can lead to the loss of lean muscle. But Apovian said the results show that in adults with severe obesity, you can improve physical function with retatrutide. The reports appear to surpass Wall Street's expectations. Where Holmes? In a note ahead of the findings, BMO Capital Markets analyst Evan Sigerman said his base case. Hey, Jerling, his base case assumption was for the drug to show weight loss in 2023 with at least a 50% reduction in knee pain. The company believes retatrutide could become an important option for patients with significant weight loss needs and certain complications, including knee osteoarthritis. In a note Thursday, Chris Stott, which is a JP Morgan analyst, said retatrutide's tolerability data or how well patients handle the treatment is somewhat worse versus Zepbound, though not surprising in our view. 18% of patients on the highest dose of the drug stopped the treatment due to side effects, compared with 4% of those in the placebo group. Eli Lilly said those dropout rates were highly correlated to patients' starting body mass index and included discontinuation due to perceived excessive weight loss. Among those with a BMI of 35 or higher who took the highest dose, 12% stopped treatment. Scott said the number is closer to the dropout rates seen in trials on Eli Lilly's weight loss drug Zepbound, obesity injection Wegovy. So, I mean, my thing about that, though, is because it might not be, it probably shouldn't have been taken by individuals with 35. They probably should have went at 40, and that's probably what they're going to do. They're probably going to have people taking it that have a 40 BMI or more. You know, and that way you probably won't see those individuals, people dropping out. Because, yeah, there is a BMI concern if you got individuals dropping out, if you got individuals, going in with a 35 BMI and they're losing 30% of their weight because that might be overshooting their specific goals. But if you got somebody like me that had a 43, 30% wouldn't be overshooting my goal because basically right now I'm 33% down at 105 pounds and that would be right up my alley. You know what I mean? So now let's just say I was taking that and it gave me more weight loss because I got that on Zepbound, which boasted 22%, right? So let's say that this particular drug utilizing it would have took me to 40%, right? I still would be fine, right? I still would be fine because that would actually probably have me right around where I want to be anyway. I probably been like 198, 199. So I wouldn't have came off. I just wouldn't have had to try to work like I'm doing now to lose the last 20 pounds, right? So I think that they're gonna actually, set who it is that the drug is the best suited for. They'll do a better job with that, and then that'll help. If you are in the chat, please smash that thumb, hit that like button, because we have 12 people watching and 5 likes. So please pause for a moment and just go ahead and smash those thumbs. Let's get those likes up. Let's get those likes up so that way they can see that this is something that the algorithm knows that this is what you want to see, suggested as a suggested video. So please take a moment and smash those thumbs real quick and get those like buttons up. And if you're not subscribed, go ahead and hit that subscription button, so that way you can actually holler at G's 101. Good at G's. All doing chores before bed and listening. Oh, appreciate you, Calamity Jane, for stopping in and hollering at us. But yes, definitely hit that like button, y'all, if y'all watching, because it's 12 watching and I got 7 likes. So let's go ahead and hit that actual thumb so that way we can get those likes up. And go ahead while you're at it and hit that bell. Hit that bell so that way you get notifications when it is that we go live. So when it is that we go live, you actually get to actually know that we're live, can come in and see us. So yeah, like I said, please take a moment and hit that like button. So Calamity Jane said, I'm currently at 37.6% total loss, have about 15, 20 pounds to lose. Yeah, Jane, I think it's a lot of people in that last 15, 20 pound to go range, right? That's all of us, right? We all got that 15, 20 pounds to go, you know what I mean? So, but yeah, had I been in that trial, Reddit would have been just fine, But again, that's because I started at a BMI of 43. So I think that it would be more appropriate probably to gear it towards individuals at above 40, that have that above 40. Unless those that 35 have severe comorbidities that they just really need it. But if we're just talking about obesity, you probably want to actually have a drug that's going to drop 40% off people, have a BMI of, at least probably 40. You know what I mean? Because that means they probably got about 100 pounds that they could lose, you know what I mean, and be okay, right? Because these are people that are probably like 250 pounds or 300 pounds and things like that, or 350 pounds, stuff like that. So that way, they could lose 100 pounds and be fine. So the other thing is, so I see a lot of people also talking about, so let me just finish the article though. I do want to finish that before we move on. So one other analyst appeared to highlight the speed and strength of the weight loss. Question, hold on, I don't want to miss the question. Are other measures being used in addition to BMI, waist circumference, or visceral fat? What do you mean, Traveling T? Other measures being used in addition to, for what? Are you talking about in the trials? Because in the trials, I think they pretty much based it off of BMI. BMI is probably what they based it off. I don't think they actually had people come. Maybe they did, but right now, it typically for the severe obesity, it was 35 and 40. But we all know clinical obesity is 40 or more, right? So basically, the BMO analyst said that and separate note on Thursday, BMO's Seekerman said discontinuing research appeared to highlight the speed and strength of weight loss was excessive for some patients with lower BMIs, but said all end results are impressive. Yes, so that's what I'm saying. 15 to 20 pounds left for me, but I'm not sure. My goals keep changing. And then it says that around 43% of patients on the highest dose experienced nausea, where roughly 33% and 21% had diarrhea and vomiting, respectively. More than 1 in 5 patients on the highest dose also experienced dysesthesia, which is an unpleasant nerve sensation. The company said it was generally mild for patients and rarely led them to discontinuing treatment. The study called Triumph 4 didn't solely focus on weight loss, meaning the other trial specifically designed for that outcome could produce different or higher results. Eli Lilly expects to report findings from 7 additional phase 3 trials on the drug by the end of 2026. So what that tells me is that they're doing, massive trials, because if they do qualify it as a biologic, which is where I think they're gonna go with it. It cuts the compounding capability out, because you can't compound biologics. It does make it more expensive, but it also makes it harder for insurance providers to deny for other comorbidities that they do cover things for, right? Like sleep apnea with Zepbound, right? So that is the one smart thing I would say, because at the end of the day, again, if you can't get the drug, how good is it for society if they can't touch it, right? So there's that. So to conclude, higher doses of tirzepatide help patients with obesity lose nearly 21% of their body weight on average in late-stage studies with when analyzing all patients regardless of discontinuation. As Lilly establishes an edge in the space, its chief rival, Novo, is racing to catch up. In March, Novo said it agreed to pay $2 billion for the rights to an early experimental drug from the Chinese pharmaceutical company United Laboratories International. Novo's newly acquired drug is a clear potential competitor to retatrutide because it similarly uses a three-pronged approach to promote weight loss and regulating blood sugar. But Novo Nordisk's treatment is much earlier in development, meaning it will take several years before it reaches patients. So there is that. Just wanted to, kind of highlight, where the week was with the Lilly stuff. There's that. But I did, like I said, jump into other, people's lives and looked at their videos, and there's a varying degree of things going on out there. Individuals, people were talking about, titration and, how some might not have felt, that titrating up is, what they thought it is. Some people is more than what they thought it is. So it's a lot of thoughts out there. But I think I would attribute some of that to, if you spend a long time on a particular dose, I feel like it prepares your body, for a titration to the point where it's not, and just being on the drug, for a certain period of time, especially, when you get to a certain point, beyond a year, I think that, there's no extreme shock and awe, anymore, but it still does the job, over time. And sometimes you got to give it time. And sometimes it's not a month or two. It might be 4 or 5 before you can really, notice what's happening. But if you still got space, I would say go ahead and move up. Because, if you're not feeling something, move up, and you still have space to move up to the next one, move up to the next one, and see if that does the trick for you. But a lot of us have that last 15 to 20 pounds, because that's kind of the space that I'm in. But I'm not rushing it, because the way I'm doing it is this is the part of the journey where I'm okay with slow and steady, because I did, the quicker part early on, because I lost 90 pounds in 9 months. You know what I mean? So to at this point, I'm all right, because now, I'm at a satisfactory weight. I'm not obese. You know what I mean? And I'm overweight, and what I'm trying to do is just get a little bit, closer, to a lower weight, just simply so I don't go into obesity when I gain weight, because we're all going to gain weight, whether you're on trips, just general fluctuations and things like that. So you want to give yourself space, so that's not a thing, you know what I mean? So I feel like if you need to go up, don't like suffer, saying, hey, well, I'm just trying to hold on, you know what I mean? Now, obviously, some say cost can be a factor, but that's only if you're on brand, right? I'm so okay with slow and steady now. I'm focused on muscle. Yeah, Shani, that's kind of where you got to be, you know what I mean? Like, because you want to see your body look a certain way. You did all of this work, and anybody that say that they don't care at all how their body look, they're not being honest. They do care about how their body looks, So that's the thing, and I'm not necessarily talking about like, it's aesthetics, when you get to this point, but again, that's why I said, don't be afraid of self-care. Once you, lose that last little bit of stubborn weight, you go ahead and do some self-care. I've not been in a hurry, and this is similar to my Weight Watchers journey. Last 30 pounds felt like it took some time, but in reality, it didn't. Yeah, you know what I mean? Listen, if we a year and a half, some people 2 years on the journey, hey, what's another, 6 months or a year to lose the last bit? Because at the end of the day, this is your life. We're not this is not going to end, when you actually lose the 15 or 20 pounds. You know what I mean? Because people that actually get to those body fat goals, like I like to be at 15%. So I already know to get from 22 to 15% is going to take, consistency. That's what it is. It's not like some special trick, right? You're not going to do anything special that's going to get you down, those other 15, 20 pounds. What you're going to do is be consistent. That's what you got to be. You got to do all the things that you're doing in a consistent way. It has to be your regular everyday life. And what'll happen is you'll see it. One day you'll just be like, whoa, okay. So the body went ahead and recomped, and I dropped it. As long as you're eating right, you're doing your resistance training, and you're doing your, some cardio, not a ton, but you're going to get where you want to go, but you just can't, cheat the process. You know what I mean? Because those that actually live in those lower body fat percentages are people that are highly consistent, right? That's all it is. That's what separates them and everybody else. Not like they went and started doing some super routine, because usually those are people that fail. I'm loving how my body responded to lifting and it's creatine. I'm slimming but bulking. Weight going down slow but gaining muscle and body's looking good. Yeah, so that's what you want. That's what you want. I said that earlier. You definitely want to look at yourself. Like stand in the mirror, because now in my undershirts, I really like my chest, the formulation of my chest looks really good. My arms are looking better. You know what I mean? Like really, really good. So the only thing I got is that stubborn midsection that, like I said, in about 6 months or so, we're going to be seeing my laser lipo guy. So he's going to take care of that because I'm not going to be fighting that. I'm 200 down to 200 pounds and I'm still worrying about a midsection. It ain't going to be me. I'm going to go ahead and do some self-care and get that on up out of here because all of my actual biomarkers, like I said, look amazing. My numbers, if I put them in ChatGPT, Google, everywhere, it looks amazing. Like my numbers come back flawless. So for my structure, I put my muscle in, and even tell me that due to muscle masking with my, having such high skeletal muscle, my BMI is off. You know what I mean? Like if I was actually to go to 184, I'd be underweight because I could pretty much hit a healthy BMI at 195, based on my body muscle, based on the muscle that I carry. So, and I don't even want to go that low. Like I said, 200 is kind of like my floor. 200 pounds is all it is that I'm okay, seeing. But I only want to lose about 10 pounds to 15 max because when I do get, the laser lipo, what's going to happen is I'm going to lose about 10 to 11 pounds because of the gallon of fat that they actually remove doing that. So with that, that'll put me at like 195 if I'm at 205 at that time. Now, say I get down to 210, I'm still at 200 pounds, right? Because I'm going to lose some weight. I'm only 9 pounds from that. And with everything I'm doing and the consistency that I'm going to have over the next several months, Lord willing, I think I'll be, I'm going to get down. I'm not going to just stay here because, like I said, I'm lifting heavy now, much heavier than I was, weights. And I'm seeing it, And of course, it's frustrating in the beginning because you see a little bit of fluctuation. You see the scale go up a little bit. But really, that's just your body recomp. You really got to pay attention to your clothing and how you look in the mirror at this stage because you can see the differences even if they're not showing up on the scale. You know what I mean? And I don't know, those that saw my last or whether you saw my last video or not. Well, before I go any further, I do want to go back. So I'm intentionally slowed mine down because I'm getting too small. I'm now wearing a 6 and I don't want to be smaller, so I'm trying to trade. So you're trying to trade the fat for muscle, so I might not lose another 20. Yeah, so you have to see. You got to see like what you look like. You know what I'm saying? It may only be 10 or 15. Yeah, so that's the thing. That's the thing. Like you got to really see what you want, and that's the beauty of it all. Like right, because without Zepbound, or tirzepatide, you might not have that option. It might not, your body might not give you the leeway to be saying that. So just think about the blessing that is. Like you said, I'm going to slow it down and I'm going to actually try to, recount 10 or 15 pounds the way I wanted to. So that's a blessing to be able to say that because before we weren't even able to say things like that. It was just like, oh, I'm just trying to lose a little bit. Yes, absolutely, Darren. Absolutely. I think that is just amazing. The progress that, you know what? Think about this. Everybody that's here in the chat, like, just think about this, right? A lot of us were like more than 100 pounds, overweight. You know what I mean? And we talking about 15, 20 pounds. Think about that. We talking about 15, 20. I lost 15 pounds in my first month. Even though we know that was a bunch of water, you know what I'm saying? It was a whole bunch of water, right? I get it. It was a bunch of fluid. That I let go of in that first month. But still, like, you know what I mean? Like, that's not, it's kind of trivial, in the grand scheme of things. I really feel like it's a wonderful place to be, where we are. I really feel like we're in great shape to actually, go ahead and do what we want to do as far as that's concerned. No, but I was talking about the ladies that might go a little too far. To your point, Shiny, I was saying that in I think it was Vanity's Live. I was over there and we was talking about like ladies that get to the lowest weight they can possibly get to, right? And how that might not be the safest thing. Because a lot of times, even on TikTok and other places, you got young people 25, 30, telling people that's 50, 60 years old, you know what I mean? Like, oh, lose the absolute most possible weight you can, you know what I mean? And get as small as you possibly can. And that is not always the best advice because and especially if it's for aesthetic reasons, because those individuals are dealing with hormonal issues and issues that people that are that young are not, along with the fact that if it is about aesthetics and looks at that point, because again, we're talking about people that are at a healthy BMI, right? So if you're at a healthy BMI, but yet you're still pushing, for the lower total body weight, right? How safe is that, if it starts to, bother other things? Because again, age matters, because you've already been losing muscle for quite a long time. Yeah, I would agree. Jane. But if you are, you know what I mean, like I said, just trying to get to the lowest total body weight that you can get to, I think that's like, it could be dangerous, when you're that age. If you're young and you just want to do it, you got that great skin elasticity and you're going to, snatch together, just by dropping fat, great, go for it. Like you said, you can gain the weight back. But a lot of times if you're older, that can be dangerous for you because if you get so low, right, and it's eating away muscle and not fat, because everybody don't have, the Renpho Morpho Scan Nova. You know what I'm saying? Some people still got old analog scales, and they getting on that and just weren't just looking at the weight, but they don't know they're losing they've lost a ton of muscle. You know what I mean? And I'm talking about older people that's 45, 50, 55, 60. You know what I mean? And they following the young people saying, oh, just lose as much as you possibly can. And they lose a muscle. And if you're losing that muscle and then you go and fall, break a hip, right? Mortality rates increase like that. So, yeah, that might be, like worst case scenario. But what I'm saying is why even go down that road, you know what I mean, for aesthetics, Why go down that road for aesthetics? You definitely want to make sure that you do it the right way. If you had the whole goal should be to get to a healthy BMI if you so choose. Now, a long time ago, I did that short where everybody saw me talk about that long-term 30-year obesity surgeon that said that people that have been obese, clinically obese for a long time, you know what I mean? Meaning like 40 or above, right? You probably don't want to actually be aiming for a 25 BMI anyway, right? You probably want to aim somewhere between the 27 and the 32. Why? Because everything about your body has morphed into something different, including, organs and things of that nature. Because people discount organs. Organs matter, right? And there can be fat around them that you want to lose, obviously, which is visceral. We know that. But you got to be very careful because that's why some people, go just a bit too far and end up looking a way that they don't feel is tasteful because they actually overshoot the mark. You know what I mean? So that's what I'm saying. So for me to be 200 pounds is actual 27 BMI for me. So I definitely understand it. I understand it. You know what I mean? But again, just with everything I shared with y'all, with the additional muscle that I carry, that actually that means my BMI is not even accurate, right? Because, in all actuality, I only got to get to like a 26 and a half to be considered healthy. That would be a healthy BMI for me because of the skeletal muscle that I carry, because of muscle masking. And some of the ladies, like I said, that are listening to the younger people, telling them to get to the lowest body are consistently losing muscle. And we know muscle is very important because if you lose all of that muscle, you're going to actually probably gain weight and not burn it quickly. You'll gain weight quickly, but not have the ability to burn quickly because muscle obviously burns it quicker than fat, right? Absolutely, Shiny. The issue is, though, some people are not as strong-minded, and they actually follow based on what they see. So you see the young girls with the pictures and all that, and you're like, oh, well, I want to make sure I like to look like that. But not thinking about, what I'm saying, like your own elasticity and where you are in your life and your actual body. Your body's probably not going to look like that body, even if you do get all the way down to that weight. You know what I mean? Because the structure for that doesn't exist. You know what I'm saying? The structure underneath all that ain't that. It's not going to snatch to that. So go for the healthy weight, but not underweight, right? Because that's what happens. And we got people out here 100 pounds now, 100 pounds. You know what I mean? Like in the 90s. They're in the 90s. And some of them are shorter women, but even that, I don't care if you are 5 foot. I just don't think 95 pounds is a good place to be, and we got people like that. No cap. Like the kids say, no cap. We got people that's in that 95, 100 pound range. You know what I mean? Like they're out here. A lot of the older ladies I'm seeing, and I'm like, man, you know what I mean? Now you sitting at a BMI of 18.5. You know what I mean? You bordering underweight, so got to be really careful about that. So there's that. That was just, like I said, another thing that I want to talk. And we were talking about dosing, right? So with the dosing, I think that if you need to go up, go up. You know what I mean? Don't make yourself suffer, or be scared that, hey, I'm gonna get to the top dose. I'm at the top dose, right? But the top dose works. So if you need to get there, get there. You know what I mean? Because guess what? There are more medications. There are more treatments coming. There are a ton of treatments coming. And obviously a lot of us are creatures of habit, and we might not want to switch, but hey, you might have to consider it. In the future, if you're on the top dose and it's no longer serving you, you may have to switch. Some of us do switch things sometimes. You might have to switch. Some people switch blood pressure medications and different things like that. If you're in the chat, let's make sure we hit the like button. Because we want, the algorithm to know that these are videos you'd like to suggest, and hit that bell too so you're notified along with the subscription. So you can actually subscribe to G's One of One, and the algorithm will know these are the videos you'd like to see. Because we got 12 people watching and just 10 likes. So if you didn't smash that like button, take a moment right now and just hit that like button. Appreciate you. So yeah, if you need to go up because with all of the actual Jourlene said that I was involved in an accident on a medical transportation van. Driver took off. Standing so great for my weight loss strength training. Saved me from broken bones. Oh my goodness, Jourlene. Was that recent? I'm sorry to hear that. Glad you're okay though. I'm at 5 and want to try the 7 again so I can not have the pain, but I'm scared of not being able to eat again. It's frustrating. Yeah. I would say still try it though, Shani. You know what I mean? Just try it, because if it don't work, just go back down, right? I just think we shouldn't pigeonhole ourselves into anything. You know what I mean? Like do whatever you need, whatever you want to do. If you want to go up, go back, because you know what? You can just go back down. Try it, see what it is, and if you feel like you can't eat again, then okay, then go back down, But don't not do it, you know what I mean? 2 weeks ago, my goodness, Jourlene. That is horrific, and I'm sorry to hear that. I'm glad that you're okay, though. Really glad that you're okay, Wow, sorry to hear that, but glad you're okay. So that's the thing, I feel like, like don't do that to yourself. You know what I mean? If the medication is there, we waited years for this stuff, so waiting this long for, medications, you definitely want to take advantage of them. You know what I mean? So that is, something you want to definitely make sure that you're not like allowing yourself to struggle through, you know what I mean? So don't struggle through. Just go ahead and make sure you actually take advantage of what's right in front of you. You know what I mean? So would I ever try retatrutide? I don't know. You know what I mean? There's always a possibility. I won't say I would never try it. You know what I mean? Yes, praise God for keeping her. 100%. I could not agree more. Praise God for keeping you, because that is we never know. You know what I mean? Like nothing's promised. And that's that just doubles down on the point that I'm making. Don't wait, you know what I mean, for things that you want to do. Don't put off for tomorrow things that you can do today. You know what I mean? So That's my thing. You know what I mean? If you feel like you need to go up and use a medication, use a medication. More drugs, more treatments are coming. So don't worry about not having the treatment, because you will have a treatment that you can use in the future. If you got to get to the top dose, get to the top dose. Because I feel like I'm on the dose that I needed. That's where I am. I'm on the 15 milligram, and it's the dose that I needed, and that's where I'm at. My wife's on 12.5, and I think that's the dose that she needed, and she's on what she needed because, and you know why? Because the effects that it had, not side effects, but the efficacy, right? It's very, when it's efficacy, you can, it makes sense. You know what I mean? So 12.5 is doing its thing for her, and 15 is doing it for me. And the thing is, if she needs to go to 15, guess what? She's going to be going to 15, right? You know, because we're not going to actually hold back on treatment. You know what I mean? You go to as far that's available. You know what I mean? And as far as anything else, you worry about it later. You know what I mean? Muscle mass help. Yes, muscle mass can help, and will help and helped you. So, but that's the thing, you know what I mean? So we ain't scared to go up, and that's where we are. So, that's pretty much it. If you guys have any questions, feel free to drop them in the chat. I like to take, at least 5 or 10 minutes and just go over any questions. So anything that you guys want to talk about or ask, because that's one thing I do want to do a better job with, because a lot of times I go so long that, it'd be time to end my video. Because, guys know I usually go about an hour and 15 minutes, hour and a half if it gets really good. But that's pretty much it. So any questions you want to have, just ask. Oh, wow, Shawnee, your little sister on Reddit. Is she on Reddit? Because I don't think Reddit's available yet. I don't think it's available yet. She on something, but I don't know if it's Reddit. Oh, man, I'm joking. I mean, hey, more power to her, you know what I mean? But I think I got to wait for the real thing, you know what I mean? But, yeah, I don't foresee myself really needing to go there, because I think by the time Reddit's actually available, like from FDA, I'm pretty sure like I probably should be at goal weight, and my aesthetic should be good. Now that's not to say that someday, some way, I don't have to low dose some kind of way, you know what I mean? Based on whatever's going on. But did she try Zepbound first, Shani? Why she go right to Reddit? Was she willing to try like an actual FDA approved medication? You know what I'm saying? Like before she did it, you know what I mean? She said she's 35, right? Is she 35? Is that what she said? Let me go back. She's 35. Okay. I had to lose like 30 pounds. Yeah. So yeah. I mean, that's. And then with her only having to lose 30 pounds, why not give Zepbound a shot? You know what I'm saying? Low dose before even trying that. Oh, so she tried to. It didn't work for her. Is that what happened? Did it not work, or was she not patient? How long was she on the tirzepatide? Sue. Darren says, Sue, man. Sue. If you got any questions, just put Q's in the chat so I know that that's what they are. So we can hang out here for a couple of minutes and answer any questions that, you guys might have about whatever you want to ask before we actually jump out of here tonight. Just, drop the Q's in the chat if you got any questions. We got 12 people watching and 10 likes, so if you could, just smash that thumb if you haven't already, and tap that bell so you can get notifications, and subscribe if you aren't subscribed to G's 101. We appreciate it. Okay, so her hair was falling out on that. Wow. So what do you think it is that So I mean, why would the Reddit be so different though? I mean, because it actually is even hitting another. Let me see. So they says it helps them maintain and build muscle. Okay. So she's with the guys who lift. That's probably why she. Did you answer my previous question about the peps? Let me go back, Darren, because I didn't know you had a question about peps. Let me see. Hold on. Peps? Yeah, I didn't see you put a question in the chat, Darren. I didn't see no Q's. Only Q's I saw was from Traveling T. About the peeps. Okay, so and yeah, my subs did increase, Darian. They did increase. I'm excited about that. Oh, you did. You did. I'm sorry, Darian. You did put a question in there at 10 o'clock. I missed that one. I probably was reading. Have you done a deep dive into the PEPs that FDA approved for pharmacy compounding? I know it's not necessarily obesity related, but many PEPs are cured. No, I haven't. I have not done deep dive. I'm gonna take a look at that. I'll take a look at that. But I think BPT 157 was one of them. Let me see. I can actually look at that up real fast, probably. So an FDA advisory panel narrowly voted a few days ago to recommend. Oh, I was right about the BPC 157. Recommended easing compounding restrictions on 6 popular wellness peptides: BPC 157, TD 500, KPV, MOTC, Epidolon, and CMAX. Yeah. So yeah, I will do that. I mean, I'll quickly run through them. I know I've talked about the peptides before this another time, but I will definitely, that'll be something I'll do. I'll deep dive next week, but I'll just do a quick summary real quick just to I'll leave us with our conversation for next week right here. So again, the FDA has narrowly voted to recommend easing compound restriction on 6 popular wellness peptides: BPC 157, TD 500, KPV, MOTS-C, Epidolon, and CMAX. This non-binding recommendation does not mean these substances are FDA-approved drugs. They still lack formal clinical clearance and await final FDA review. That just means you need electrolytes, Jerlene. You need electrolytes. So if you have like the little packets, maybe do a little bit of that. If not, you can do like a mineral or salt water to actually. But that's what that means. That means that you probably could be and you also could be from muscle tearing, from that. So that'll go away. It's temporary. So BPC 157 is recommended for inclusion to treat ulcerative colitis. TB 500 and KPV recommended to promote wound healing and reduce inflammation. MOTS-C is recommended to target insulin resistance, obesity, and osteoporosis. And the Epidolon and CMAX are recommended to address insomnia, migraines, and nerve pain. Imdellitide, which is DSIP, is voted down and excluded by the panel. No formal approval. So these wellness compounds are not FDA approved finished drugs, and the recent vote only addresses eligibility for specialized compounding pharmacies, right? Scientists' opposition. Career FDA scientists recommend against clearing these chemicals due to clear lack of human safety and efficacy data. Next steps. The final decision rests with FDA leadership and could take several months to formally process. You can check official updates via the U.S. Food and Drug. So basically, this is not FDA approving anything. It's just basically allowing compounders to compound. But it's still clearly saying that one line, right? What's that one line that I just read? It says that FDA scientists recommend against clearing these chemicals due to clear lack of human safety and efficacy data. So what this gets into is there's no money for trials for this, right? Nobody's spending money to actually create trials to actually see, because that's all the separation is, right? The separation is simply that. It's literally just that, there's no trials to actually test and see what, the long-term results is officially, you know what I mean? So that's the problem. And as far as the belly or the tummy, Shawnee, because I think that was a question. You could always go my route and get that laser lipo. Get a laser lipo, and they could throw some helium in there and tighten you right on up to tummy fat gone. That's FDA approved. Miss G, so she is at 145. And her goal, she's at about 10 or 148. I think it might be 148, and she got about 10 to 13 pounds to lose. So she is close. She got about 10 to 13 pounds left to lose. So she's done amazing. Though she's down 52 pounds. So And she on 12.5 and looking good. I'll post a picture of her next. Like when I get off this live, she had an event yesterday. So I'll post a little little picture. Oh, don't be scared, Shani. I'm not saying nothing crazy. It's just a little bit of suction. That's all it is. A little teeny little bit of suction to get that fat up out of there. It's not really surgery like that. You know what I mean? Don't be scared. Zumba take some salsa or mango manjaro. So Jason, she said you gotta go dance. I thought so because in the pics on vacation she looked good. Yeah. Oh yeah, appreciate it. Yeah. So she she down to 148 or 145. Yeah, she's floating in between that right now. But yeah, she's definitely going to be trying to get down to 135. But she went to the consult with me, so she's also gonna probably do 360. And it's literally micro. Dancing and moving those hips, back, and core muscles. There you go. So Calamity Jane said, go ahead, and JC Calamity Jane said, go ahead and do some dance moves to get that tummy fat. But no, I think that at some point, some of that is going to be very difficult to get rid of, especially like some of it's just going to be really stubborn. And I would say, there are some things out there, but again, most of it's not FDA approved. So, I would say, do all of the things that you know to do, with the getting proper sleep, hydration, and making sure that you eating those whole foods like you are. Keep lifting and the best. Do the best you can. To actually drop that body fat. But the other option is self-care, because make no mistake, liposuction is just self-care. You know what I mean? It's not. I'm not telling you to run out and get a BBL. If you want to get that, that's cool. I remember I'm in zone 2. Dancing won't get it, Jen. Hey, listen. Not a candidate. Yeah, so yeah, so that's the thing. As long as you had a healthy weight, you could definitely like I said, get some lipo. Like I tell anybody, once you had a healthy weight, why not? It's self-care. It's nothing wrong with it. And I think you should I tell you what, just educate yourself on it. You know what I'm saying? Just educate yourself on it, because I think there's a lot of stigma, just like it is with GLP-1. With the surgery, because people look at people getting, well, yeah, you're a diabetic, so that's a little bit, I understand that, Jane. I understand as a diabetic, it's more risky. It is more risky, any kind of surgery, but if you're not, and you're at a healthy weight, why not? Because I'm telling you, it's so minuscule. I mean, when I tell you that little thing is like about that big, these are micro, like micro, it's not like the old school thing where they dragging a thing across and doing all this crazy stuff to you, or you seeing people get BBLs with stuff and the tummy tucks where they ripping you off. There's not nothing like that. It's very, very minimally. They don't even put you to sleep for what I'm talking about. They literally don't even put you to sleep. So what I'm saying is just educate yourself around it, and sometimes you become more open to it, because it's not what social media and the grand scheme of what people usually see, with surgery. They think about the girls with the the big old, breast and the behinds and all that. This is not what I'm talking about. You know what I mean? What I'm talking about will not be cutting you or doing any of that. It's literally like, this very, very small micro tool that literally would go in there and get that, that excess fat right up out those areas. And then they use a substance that actually goes in. It's kind of like helium, and it tightens you right on up. So it's not invasive, and you're up the whole time. You're up the whole time. You're not like literally going like a serious tummy tuck where you're getting slit down and all that. Yes, they do. They do, Darren. And there's so many men do it, but they don't say anything. They're not honest. They just like keeping it in the closet. But while me and my wife were there, another guy came in. So yeah, guys are doing it too. Why? Because like I said, I'm telling you, I could probably get down to 195. I'm still gonna have these little flanks here. Like I can't. It's not much you can do, but I refuse. My belly don't look bad. My waist is 32. Well, you can't see visceral fat though, Shani. You know what I mean? You can't see visceral fat. So, yeah, you can't see visceral fat. So the thing is, like, if you see anything at all, it's subcutaneous, and that's what I'm saying. It's literally like not harmful to do what you need to do with that. You know what I mean? And again, with the tools and stuff they use, I'm just saying, look at it. Just look into it. It's not, because again, people be so scared because again, they have their visions of TV. You got the visions of the girls on the videos and all of the social media stuff. You look at the people with, like I said, the big breasts and the big butts and all that. This ain't that. This ain't that. This ain't that. Yes, and that's why, Shani, that's why I'm saying to you, for a self-care reason, look into getting some laser lipo. I'm telling you, Shani, don't shy away from it, because sometimes it's needed, especially when you've actually went to the weight, like being a larger weight, like you were in a larger body, you know what I'm saying, and losing as much weight as you have, sometimes it's needed, you know what I mean, because you can't crunch, lift, do anything about that, aesthetically, technically, without some assistance. You know what I mean? So it's nothing wrong with it. And I just wish more people would actually just educate yourself a little more on what that lipo is like, and that laser lipo is like. Yeah, okay. Well, I would definitely just check into it, because it's very minimally invasive, the one that I'm talking about. If you want a big chest, strong back, 8-pack, triangle shaped body, glutes, you want to do it and go wild. Damn crazy. Everyone has to be comfortable in their own skin at the end of the day. Just talk to your medical team and walk through the process. We have to grace ourselves. Absolutely. Not anesthesia unnecessary. I'll deal with it. Yeah, Shani, there's no anesthesia. You're not going under. See, and I'm glad you said that, because that literally tells me that you've never really looked into it. You really haven't. Because to say that means that your vision of it is, again, social media, the girls online, you see them with the big boobs and the butts and cutting themselves open and getting all that. That's not what I'm talking about. I'm talking about minimally invasive lipo. It's a small, the tool is so small. I'm telling you, the little incision is like that. And you're not even put to sleep. You're not put to sleep. You're woke. You're woke. And that's why I'm saying, like, it literally is not, they just numb it. They numb the area. And that's why I'm telling you, look into it, because it's really not that bad. It's really not that bad. Because trust me, I wouldn't do it. I would not do it. I would not do it. Trust me, I wouldn't do it. My wife wouldn't do it. We not about it. Okay? So I'm just saying, but we don't talk about this because people aren't open. That's just like GLP-1. You still got people lying about that. Oh, I ain't taking that. You know what I mean? And I know you didn't. I know you didn't, Shani. I know you didn't. That's what I'm saying. I never looked into it. You don't think it's crazy for me sitting here talking about something lipo? It's crazy for me. But this is where we are. This is where we are. Like, you have to, this is simply self-care. You know what I'm saying? You got some guys that will never go to the spa, right? Meaning like to get their feet done. You know what I'm saying? And it's just self-care. You know what I mean? Like, it's not a bad thing. But we actually have these societal norms that actually scare people away from things that actually could be beneficial. You know what I mean? It's really not. It's really not. My son was at the spa with my wife and daughter. Why? He's an athlete. He actually, I felt like it was a good thing he went. You know, he got his nails, his toes and all that. You know what I mean? And my son, tough. He run around lifting 400 pounds and he at the spa. So we got to just kill the societal norms and being afraid. Self-care is very important. You work to lose a lot of weight, and some things you're not going to be able to do, you know, like with just, you know, resistance training and eating a certain way. You have to get a little bit of assistance. And I know with me doing all that I've done, all that my wife has done, with everything we've done, and then being at a certain age, it's okay. It's absolutely okay. You know what I'm saying? It's absolutely okay. And it's okay to look into it. So just look into it, educate yourself a little bit on it, and I think you'll be fine, because you don't even get put to sleep. So there's that. I think I did answer all the questions in the chat. I think it was an amazing live tonight. I do appreciate y'all for showing up for me. You know, Shani, Jane, Darium, Z, Traveling T. You know what I mean? If I missed anybody, I'm sorry, but you know, I appreciate it. And anybody that's in the shadows, because we've had 15 people in here at one point. Geraldine, yes, don't want to miss you. You know, so that's the thing, like, you know what I mean? Like, some people might be in the shadows, but if you came here and you rock with me tonight, I do appreciate you, and I thank you for you know, tuning in and giving a little bit of time to G's 1 of 1 tonight. So I'll bid you guys adieu for tonight, and like I like to always in all my lives, obesity warriors, stand up. We in this together. Later.